Okay, we're going to go ahead and get started. And committee, we're going to open up the hearing on House Bill 2390 and establishing the Kansas Overdose Fatality Review Board and excluding tests to detect the presence of fentanyl, ketamine, or gamma hydroxy, what?
Hydroxybutyric acid.
Yes, that word right there, in a substance from the definition of drug paraphernalia. So we'll hear from Revisor Abbott first.
Thank you, Madam Chair, and good afternoon, committee. The odd time when somebody shorter than me was here before. House Bill 2390 was sponsored by this committee. As the chairwoman said, it would enact the Kansas Overdose Fatality Review Board Act and establish the Kansas Overdose Fatality Review Board. The purpose of the board would be to review information and data related to drug overdoses in Kansas and to make recommendations on evidence-based strategies to prevent or mitigate the consequences of drug overdose in the state. The board would be established prior to January 1 of 2025 and be in operation by that time. The board would consist of, I lost count, but a number of members. They would include the Secretary of KDHE as the chairperson of the board, 5 other ex officio type members from KDHE, including division or bureau chiefs and officers appointed by the Secretary of KDHE. It would include appointees to represent a number of state agencies. Those would include the Attorney General, the KBI, KDADS, DCF, the Department of Corrections, the Board of Pharmacy, the EMS Board, the State Board of Healing Arts, and the Behavioral Sciences Regulatory Board. It would also include 5 other members jointly appointed by KDHE and KDADS, including physicians with specialization, a coroner, a mental health and substance use disorder treatment provider, and 1 member from the public who is in long-term recovery from substance use disorder. The board could also include up to 5 additional members appointed by KDHE from relevant disciplines or stakeholder groups. The secretary under the bill would be required to identify drug overdose death cases, review autopsy reports, death certificates, medical records, and other relevant data to the drug overdose fatalities, review those persons' interactions with the healthcare system, educational institutions, the criminal justice system, and other institutions prior to a drug overdose death, contact other persons who have relevant data, consult with the Overdose Fatality Review Board to evaluate the data, make determinations on the preventability of drug overdose fatalities, develop recommendations, and disseminate findings to the governor, the legislature, and the public. The secretary under the act would have access to law enforcement investigative information, autopsy records and coroner's investigative records, medical records, EMS records, dispensation records from KTRACS, the state's prescription monitoring program, and all of those records would remain confidential and not be subject to disclosure under the Kansas Open Records Act or otherwise disseminated to the public. The bill would also amend the definition of possession or amend the definition of drug paraphernalia in the Kansas Criminal Code. This would be to exclude materials to test for the presence of fentanyl, fentanyl analogs, ketamine, or GHB. This would have the net effect of making the possession of those testing materials not constitute the crime of possession of drug paraphernalia under the Kansas Criminal Code. Finally, the bill would also amend provisions of law relating to emergency opioid antagonists. This is largely a technical grammatical clarification that the wording in the existing law that governs who is shielded from liability in civil or criminal proceedings for administering an emergency opioid antagonist would simply restructure the sentence to make it more clear that the intended people are covered by that liability protection. Madam Chair, the bill would take effect upon publication in the statute book, and I'd be happy to stand for questions.
Thank you, Scott. Questions for Revisor Abbott? Scott, I just have a couple. Is there, and I just don't recall seeing it in here when I read through this, is there a penalty of some sort for violating the confidentiality from this task force?
So, Madam Chair, there is not a separate, distinct penalty attached to the members or the other people involved with this task force. Anything that exists in law currently, whether it's law enforcement, healthcare providers, if there is another avenue in law that would hold them liable for the dissemination of that information, that would still apply. But there is not a separate and distinct penalty or other enforcement mechanism in this bill.
So you're saying that somewhere in our statutes we have such a thing to deal with this?
I would say for most of those cases, for instance, healthcare providers, confidential privileged information, law enforcement records, there are provisions of law that govern many of those things already.
Okay. While we're going through some things, would you mind just searching real quick and see what you can find for me? And then when you were given direction to draft this bill, were you given any indication as to why we are doing a joint appointment for some individuals?
Madam Chair,
That's page 3.
Yeah, so I believe those 5 members who were jointly appointed by KDHE and KDADS, no, the only direction was that those members would be appointed by those 2 officials. There was no direction as to who gets which appointments or how it would be divided.
Okay, and then also reading through this, there's no report issued to any of the health committees, is that correct?
Madam Chair, that's correct. They're required to report to the legislature, which means the report is submitted to the chief clerk and the secretary of the Senate, kept on file in their offices, available to members of the legislature, but it is not directly provided to specific committees.
Okay. That's all my questions. Committee, are there further questions for Revisor Abbott? Representative Orpeza.
Thank you, Madam Chair. So my question is, I know you said an additional up to 5 members, but as you were listing off members, I didn't hear anything from like a nursing standpoint. Is that correct?
Yeah, Madam Chair, Representative. So these are the members listed on page 3 of the bill, lines 7 through 16. It's a physician with training in psychiatry or the treatment of addiction, a physician with training in medical toxicology or forensic pathology, coroner or medical examiner, person in long-term recovery from substance use disorder, or a Kansas licensed mental health and substance use disorder treatment provider. There is no specific reference to any discipline of nursing in that membership.
Thank you.
Committee, are there further questions? All right, seeing none, thank you very much, Scott. Okay, committee, the first conferee that we have up as a proponent is Dr. Joan Duvet. Did I pronounce that correctly? I did it, did I?
It's okay.
Is it a long E?
It's Duvy. It rhymes with groovy.
Duvy. Something told me as soon as that came out of my mouth, it's a long E. And we're going to put everyone on a 3-minute clock because of the number of conferees that we have today. So you'll hear a little ding or something up here. So
Okay, just
welcome to committee.
Thank you so much.
And we need everyone to state who they are and who they're with, et cetera. And you're the state health officer.
That's exactly right. So Chairwoman, Landwehr, and members of the committee, thanks for allowing us to speak in support of House Bill 2390. I'm Dr. Joan Duvey. I'm a family physician, and I'm the state health officer at KDHE. Working together, KDHE and KDADS, the Kansas Department of Aging and Disability Services, rise in support of this bill. The Kansas Office of Vital Statistics reported 678 drug overdose deaths in 2021, and that was a 42% increase compared to 2020. The increase in Kansas dying from overdose has largely been driven by deaths involving potent synthetic opioids like fentanyl. In fact, a synthetic opioid like fentanyl was determined to be involved in 4 out of 5 of the opioid-related overdose deaths among Kansans in 2021. The increase in overdose deaths involving these synthetic opioids over the past 10 years in Kansas is frankly alarming. From 39 in 2012 to 347 in 2021. That is an increase of nearly 800%. The truth is, Fentanyl is killing our kids. It's killing our parents, our neighbors, and our friends. It's important to remember that opioid use disorder is a chronic, relapsing, and remitting brain disease, and there is treatment available. But in order for people to get treatment, we need to keep them alive. In response to the surge in fentanyl deaths, this bill does three things. As you heard, it allows the use of test strips to determine if substances contain fentanyl or club drugs, that ketamine or gamma hydroxybutyrate, provides for implementation of a statewide overdose fatality review board, and clarifies language in the naloxone statute. First, I'm going to talk about fentanyl test strips. Fentanyl is a highly potent drug, and it's commonly added as an adulterant to other drugs. It's highly addictive, 50 times more potent than heroin, and 100 times more potent than morphine. It's tasteless and impossible to identify without testing. And very small amounts, like 2 grains of sugar, can be fatal. In most recent cases of fentanyl-related overdose are linked to illicitly manufactured fentanyl distributed through illegal drug markets. Fentanyl is often added to heroin, but it's also found in counterfeit pressed tablets that resemble prescription opioids or anxiety medications like Xanax, and even in eye drops. Many people are unaware that the drugs they take contain fentanyl. Cutting drugs with fentanyl makes them cheaper, more powerful, more addictive, and more deadly. Legalization of these strips will make it easier to identify fentanyl in the drug supply. They're small strips of paper, like pregnancy tests, okay? Communities and people can take steps to reduce overdose. Next, I'm going to talk about opioid fatality review in my 30 seconds left. This is a cross-cutting strategy to better understand circumstances surrounding opioid overdose deaths, as you heard, so that we can identify best practices for prevention and intervention strategies. There are states that are doing opioid fatality review, and they have come up with great.
Time.
Okay.
All right, thank you very
Yeah.
much. We appreciate it.
Thank you.
All right. Now, I am going to ask a question. Is there anyone, because we know that there's another hearing going on simultaneously with this one dealing with the similar subject, is there anyone that has to get out of here, like, fast to get over there? Okay, let's get those three up first. So, Jason, will you introduce who we have here? And I assume they're on my list, so. I'm sorry, Representative Pros.
That's fine. This is Brandy Harris from Hutchinson.
Welcome to committee.
Thank you, Madam Chairman, and the rest of the committee. And I apologize, this is my first time publicly speaking about this. I am not here today as a medical professional or anybody who has any knowledge of particulars or statistics. You guys have plenty of people here for that. I am here because I lost my son to fentanyl. When my son was about 13 years old, he was riding his bicycle to football practice. And as a result of this, the injuries he sustained in that accident, he was prescribed pain medication. And 13 years old, he was very susceptible, and that led to quite a few turbulent teenage years. Sebastian ended up going to rehab, and Sebastian had really cleaned his life up, and he was making a lot of progress. He had held a job for well over a year, and he had a wonderful girlfriend that he shared a home with, and Sebastian had always taken care of his little sister. My daughter was born with a chromosomal abnormality, and he was just like her protector always. And I know that Sebastian would have never chosen to leave her especially. But on April 15th, for reasons we do not know, Sebastian decided to relapse. And the substances that he bought that he thought were opioids were fentanyl. And Sebastian was not given a chance to get better. He was not given any chance to be able to recover from this. Sebastian's life was taken before he could give me grandkids, before he could make a life for himself. And I believe that with fentanyl testing strips available not only to medical providers or people in schools, but also people that are using. You know, I don't think that anybody decides to use well, I'm sure there are some people that choose to end their lives that way. But the majority of overdoses that have happened with fentanyl have been because the fentanyl was in their product unbeknownst to them. We've all made mistakes, and we need to be able to learn from those mistakes and grow from those mistakes, but Sebastian's never, ever going to get that chance. I'm sorry. So Sebastian was 21 years old. He would have turned 22 on July 14th. And his life ended because of fentanyl. I appreciate you guys taking the time to listen to my testimony. And if you guys have any questions, I'm here to answer them.
Brandy, I want to say thank you very much, because I know those stories aren't easy when we lose a son. So
Thank you very much.
appreciate you being here today. And I have got two others that need to leave. Who are those? All right, if you'll tell me who you are.
My name's Libby Davis.
All right.
I am here today, also as the mother of a 16-year-old son who lost his life after being poisoned by a fake pill containing illicit fentanyl almost 18 months ago. Over those past 18 months, I've come to learn a lot about illicit fentanyl. And I am a nurse. My husband is a nurse anesthetist. We're very familiar with the drug fentanyl. But prior to our son's death, we knew nothing about the epidemic that our country is facing in regards to the unprecedented amounts of illicit fentanyl that come across our border. So despite much effort, DEA is unable to stop that illicit fentanyl from coming into our country. So my thoughts are, if we can't stop it from coming into the country, we must use every harm reduction tool we have available. Fentanyl testing strips is one of those. Kansans currently have access to Narcan, which is a reactive harm reduction tool that anyone can go to a pharmacy and purchase. Why would we not also want to make available a more proactive harm reduction tool, which could be fentanyl testing strips? The availability of the test strips will only increase awareness about the fentanyl crisis in our country that definitely needs more attention. The reality is that addiction is a disease of the brain, as we've already heard. And with the massive and rapid influx of illicit fentanyl, cartels are driving addiction and creating repeat users due to its high potency and addictive nature. This is the Mexican cartel's #1 goal, and their business model is working. So we need to have a nimble and comprehensive response to this clear and present danger. We need a COVID-like response to combat this crisis. Harm reduction is all around us, from seat belts to sunscreen and bike helmets. We are always looking for ways to protect life. And that's what harm reduction is all about, saving lives. And we need to meet all Americans where they're at, even if they're struggling with the disease of addiction. Fentanyl testing strips are simple, inexpensive, and evidence-based. Legalizing fentanyl test strips will not only save lives by preventing overdose, but can also help connect people who use drugs with other services and resources they may need, including treatment to help them quit. And that's pretty much all I had to say.
Libby, thank you very much for coming here and sharing your story with us. Appreciate it. And we've got one more individual. Where was that? All right. If you'll give us your name.
Yeah, good afternoon, everyone. Good afternoon. My name is Erica Holliday. I'm the substance use coordinator out of the Wyandotte County Health Department in Kansas City, Kansas. So I have been working in substance use, particularly with those addicted to heroin and meth, since 2015. Ironically, that was the same time fentanyl kind of hit the scene and became pretty effective. And when I started working, my coworkers were very much like, we have never seen anything like this before. This is making people act crazy. We've never seen it before. It's, the brain disease that's affecting is stronger than ever. And not only are their decision-making more extreme, their right to decipher right from wrong is more extreme, but they're dying more than they've ever seen before. Since 2015, as we know, fentanyl has only increased for folks with substance use disorder, as well as those of us working in the field. And usually it affects folks using opioids, right? Folks like using heroin as their primary drug of choice. And we've been able to track that. It's still hard, but we can handle it. We know who we're trying to help, who we're trying to reach to get into recovery. But since 2020, this is not the primary folks this is affecting anymore. We are now seeing fentanyl in things like stimulants, meth and cocaine. And I've got people who are terrified because they don't know what they're taking. People who have stimulant use disorder, they're not used to being at risk for overdose. People who are taking stimulants don't overdose. When that happens, it's not the usual opioid situation. We need the fentanyl testing strips to be extremely helpful in being able to decipher what they're using. I've worked in states that have legalized fentanyl testing strips, and I'd have folks come into my office absolutely terrified because they didn't know if what they're used to using is going to kill them or not. As well as that, in Wyandotte County, we have seen, as some folks have shared, specific instances, a high increase of overdose amongst our younger youth population. That's 21 and younger. That's because of this counterfeit pill issue. A lot of teenagers have been trying drugs and experimenting for 10, 20, 30 years. It's not anything new. The primary difference is now these drugs have a chance to kill them immediately. Folks who are making drugs, people selling drugs, they're not measuring the amount of fentanyl that's going in there. They're just sort of sprinkling it in and seeing what happens. If someone's going to try a drug once, they don't know the change and the effect that could occur. So in Wyandotte County, drug overdose has increased by 146% since 2020. This is directly due to the rising amounts of fentanyl in our drug supply. I got that number from raw police data, so that's folks responding directly from the scene. So it's critical we test this drug. It has the ability to know it's safe, not only to educate our youth and our community members, but to keep people safe and alive so we can get them into recovery. Thank you.
Thank you very much for being here today. Is there anyone else that we've missed that's got to go to the next committee? All right, come on up.
Thank you,
and tell us who you are.
Okay. My name is Paula Mitchell. I am a victims advocate for Bright House. We work with domestic violence, sexual assault victims. And so right now I want you guys to think, if you're a parent of an 18, 19, 20-year-old, or have a grandkid of that age, I want you to put them in this story. So in the second year of college, I was at a party. Our basketball team just won against our rival, and my friends wanted to go to this party. I'm like, sure, I'll drive you. I don't drink. I took them. We hung out. It was music, games. It was lots of fun. And I was sitting there. I was drinking Dr. Pepper. I ran out. So the gentleman of the house, I use that term loosely, came over and asked if I would like anything to drink. I'm like, sure, if you have a pop or water, that'd be great. I'm driving, and he's like, yeah, sure. He goes to the kitchen, comes back with a can of Dr. Pepper. Didn't realize at that point in time it had already been opened. So I'm sitting there drinking my Dr. Pepper, and I get halfway through that can, and I start feeling funny. I started getting dizzy, almost like I had been drinking. I had not. I went to the bathroom, splashed some water on my face. Didn't help. I opened the door, and they're standing right there. I'm like, I need to leave. I don't feel well. Well, we have this spare room in the back. Why don't you go lay down, see if it feels better? Your friends are just fine, and you can lay back there and see if you feel better. I'm like, okay. So I go back there. I lay down. My body can't respond to anything. It's heavy. It's weak. I'm dizzy, as if you scan the room and everything just blurs. I come to, I have 4 of the basketball guys on me. One at the top of my head. Patting my head saying, it's okay, it'll be over in just a little bit. I could not scream. I could not fight them off. I was paralyzed by that drug. I couldn't do anything. And that happened back in the early 90s. A couple of weeks ago, I took my daughter out for her 21st birthday. She wanted me to be a designated driver. We're there, and we go out to dance. And I'm watching our drinks while the girls are dancing, and I see a gentleman walk over and mess with our drinks. 2 weeks ago. As we're leaving the dance floor, I tell the girls, do not touch your drink. Whatever you do, do not take a drink. We walk over there, we sit down, I grab my cup and act like I take a big old swig. And instantly, he is hovering over us. We get the bouncers, they called the cops, they tested took all those drinks and tested them. Every single one of them had the date rape drug in them. And if I didn't see that, all those girls could have been in the same spot I was. But if we had those strips where we could test them ourselves, we wouldn't be in this situation. So currently, as an advocate, I have 4 high school girls, age 16, that are going through this exact same thing. They were all 4 raped by a couple of gentlemen that used date rape drugs in their drinks. So I really hope that you really consider about passing this and getting this through, because it would save a lot of girls. And I want to thank you.
Thank you, Paula, for being here today, and we appreciate you sharing your story. Is there anyone else that's going to the other committee? All right, seeing none, we're going to go ahead and start off our list. I just want to say, I'm sorry for those of you that lost your sons, and I'm sorry for what happened to you. So thank you for being here. All right, I have Kyle Kessler, Executive Director, Association of Community Mental Health Centers of Kansas. Welcome to committee. 3 minutes on the clock.
Thank you, Madam Chair, members of the committee. I am Kyle Kessler, Executive Director at the Association of Community Mental Health Centers. We appreciate the opportunity to appear here this afternoon in support of House Bill 2390. You have our written comments, and we have some statistics and some of our ideas related to this bill for why it's good legislation and needs to pass. And so the 2 things that I would really leave you with specifically is that I had a chance a couple weeks ago to visit with one of our mental health center directors in the Kansas City area, and he said, Kyle, people would be shocked if they knew what percentage of youth are withdrawing from fentanyl who we have in our substance use disorder inpatient facility. I said, well, Tim, don't keep me in suspense. What's the percentage? He said 100. Every one of the kids in those beds were withdrawing from fentanyl, and they were not intentionally using that drug. So, this isn't, in my mind, it's a different type of drug usage. It's poisoning, is what one of the previous speakers so eloquently said. And so we in the long run absolutely believe that this type of legislation is a core piece of our prevention strategies. Our association acknowledges we need to up our game in terms of behavioral health prevention strategies, and we would urge you to pass this bill when you work it, and I'll stand for questions at the appropriate time, Madam Chair.
Thank you, Kyle. Appreciate it. Under the clock. Next, I have Tara Mays, Vice President, State Legislative Affairs, Kansas Hospital Association. Welcome to committee, Tara.
Hi, Madam Chair. I am Tara Mays with the Kansas Hospital Association. I will be very brief. We appreciate the opportunity to also lend our support on behalf of our 123-member community hospitals across the state of Kansas in support of House Bill 2390 for all of the important reasons that you just heard. Our hospitals a lot of times are on the front lines of treating some of those that are very much in crisis and overdose that get treatment in our Kansas hospitals. And for that reason, we would ask that if the committee work this bill, they consider an addition to the membership of the committee, as was noted in new section 2 on pages 2 and 3 of that bill, to have and include a representative that works on the hospital that understands kind of the impacts to the workforce on those overdose. With that, I'd be happy to stand for questions at the appropriate time, Madam Chair.
All right. Thank you very much, Tara. Next, I have Dr. Anthony Strickland. Welcome to committee, Doctor.
Thank you. Thank you, Madam Chair and committee members, for the opportunity to submit this testimony. My name is Dr. Anthony Joe Strickland. I am a board-certified family medicine physician as well as an addiction medicine specialist. I've been serving the people of Kansas for over 8 years, both in directly providing care, but also in administrative roles that give me special insight into some of these strategies that we're talking about today. I've also worked as the medical director for DCCA DECA, which is a drug and alcohol treatment center, medical director and chief medical officer for a federally qualified health center, community health center, as well as the chief medical officer of a community hospital. I've also worked within the prison system, transitioning folks from incarceration with substance use disorders into the community successfully to mitigate relapse and death. I also am a consultant for different agencies who provide this care, such as community mental health centers, as well as behavioral health centers, and I am the treasurer of the Midwest Society of Addiction Medicine. In addition to serving Kansas, I'm also licensed to practice in the state of Missouri and have taken care of many patients in that area as well, which has a whole slew of other policies, legislative policies, and I've seen the impact of those policies as well, some of which they've been playing catch up to some of the progressive things we've done with K-Tracks, but some of them are things that we are talking about today that I have seen the specific benefits of. One such story that I'd like to share with you was a patient of mine who was in longstanding recovery for over several years, who I had distributed naloxone to, which is that life-saving intranasal drug for overdoses. She had never needed it in 2 years. She had not had a relapse, and we were very thankful for that. But having that available, it was very important to her. She said she kept it on her, kind of like if you had a bee allergy, she kept it with her like it was her EpiPen, that she could save somebody else, especially since she knew so many people who also struggled with substance use disorder. And sometimes people are in recovery for many years and have a single slip-up relapse that can be fatal, like we've heard about earlier today. Well, in this particular case, she was having a Labor Day party with her friends at the lake, with her family, her 16-year-old and 11-year-old, and she went into town to get some gas for the boat. And while she was gone, her son, who had a sports injury, had been taking oxycodone, and when ran out, got some from his friend because he still had a lot of pain. And what he did not know is that that oxycodone tablet was fentanyl, and he overdosed with that single pill that he took. And that 11-year-old girl, the daughter, knew where she kept that Narcan, that little naloxone intranasal stuff, knew how to use it, and saved her 16-year-old brother's life. This was a year and a half ago, not that long ago. And only one of many instances that I know where these kinds of situations have saved lives. And other situations where individuals, I had a patient who saved someone's life at a gas station. And it's important to have legislation that can save these heroes from counter lawsuits when they're trying to help and save people and they have the wherewithal to be trained to help save lives with these medicines. And we also need to be able to keep people from falling through the cracks and study these things effectively, which is why I also support the Overdose Fatality Review Board, which will put experts in the field together to accomplish that goal. Thank you for giving us these tools to fight this epidemic, and I appreciate the progress that you've made so far and that we'll continue to make.
All right, thank you very much. Appreciate you being here today. Next, I have Janet Williams, PhD, private citizen, on virtual.
Hello, I am here. Can you hear me?
Yes, we can hear you. Go ahead, Janet. And we're
Yes.
giving everyone 3 minutes.
Yep, I don't even need that. So,
Okay.
I want to thank you, Chairperson Lemware. And this isn't the committee I usually come and testify to. I'm here for 2 reasons today. One is I work with people with brain injuries and have for the past 32 years in the state of Kansas. And for the first time ever, we're starting to get referrals of people who had fentanyl overdoses and now have brain injuries as a result. And so they're starting to use the brain injury waiver, and it only takes 3 to 5 minutes for someone to lose enough oxygen to have a significant brain injury, significant enough to be eligible for the brain injury waiver. So I think as you are factoring in everything else, factor in the cost of what it costs Kansas to save people when we could have possibly prevented some of this. Sorry about those dogs. Hang on one second. They don't listen. Anyway,
No, that's kind of like my household, so you're good.
I just walked them so that they would sleep, but they're not listening yet. Anyway, the second thing is I'm the parent of teenagers, and I'll tell you, my kids would come home from parties and tell me all the different drugs that were available. Would they have tested it? I think I probably could have convinced them to test some of what was being handed around. My kids carry Narcan. I make them carry it. Every school in Kansas is starting to carry it. And I'll just end with what my 19-year-old said to me. You know, I said to her, I'm going to testify to this committee. What should I tell them? And I said, will fentanyl make people use drugs? She said, no, Mom, it will reduce overdoses. Kids who are going to use drugs are going to use drugs, whether it's the first time or the 10th. Test strips would allow them to stop playing roulette. It makes no sense that we allow Narcan to revive someone, but don't allow test strips to prevent the overdose to begin with. So I'm asking you to pass this very important legislation so that people will, be able to prevent these before then using Narcan, saving someone, and then possibly needing brain injury waiver services and having people have a lifetime of disability. So those are my comments, and I applaud everybody who's standing up today and testifying, especially the families who've been through this. I know what you're going through, and I just really appreciate the time today. Thank you.
All right. Thank you very much, Janet. I appreciate it. Next, I have Seth Dewey, Kansas Recovery Network, also virtual.
Hello, everyone. Thank you so much for the opportunity to give this testimony. Like she said, my name is Seth Dewey. I am a co-founder of the Kansas Recovery Network, and I'm also a person in long-term recovery myself. What the Kansas Recovery Network is it's a grassroots harm reduction coalition that has worked to make sure that individuals in our community in Reno County have access to naloxone in partnership with other organizations. In the process of that, we make sure that we're working with our community partners. As has already been brought out, in 2021, the state of Kansas recorded 680 overdose fatalities, and that's a 43% jump from 2020. That makes Kansas number 2 in the nation for increase in overdose fatalities. That's not the list we want to be at the top of. And as we've also determined from everyone else's testimony, that fentanyl is the reason for that, not just because of the fake pills, but also because of it being mixed in with other substances. So therefore, being ingested unknowingly. The numbers from 2022 are going to tell us the same thing. It's still going to be on that increase. Fentanyl test strips can warn an individual of fentanyl being in that substance. Of a group studied in Rhode Island, about half of those that received access to fentanyl test strips and receiving a positive test result after using fentanyl test strips, they altered their use by taking simple measures. Some by not using alone, using a lesser amount, and in some cases, not using or discarding the substance. Now, let's think if 680 of those 680 fatalities of those Kansans that died in 2021 would have had the chance to change their using patterns because of that simple piece of testing paper that costs about $1. Overdose fatality review boards and fentanyl test strips are proven public health. Just asking to be able to use them as such. Thank you.
Thank you very much for being with us here today. Next, and let's see if I can butcher this name, is Anoya Barnett, Program Director of Safe Streets Wichita, also virtual.
Good afternoon. Thank you, Chairperson Landwehr and Vice Chair Epley and other committee members for the opportunity to address the committee today. My name is Anya Barnett, and my pronouns are she, her. I am the Program Director for Safe Streets Wichita Coalition. We focus on substance use and overdose prevention, and we've recently been able to pass out hundreds of naloxone drug reversal medication to targeted areas in Wichita. Now, let's talk prevention and fentanyl. According to drugs typically used to treat patients with severe pain or to manage pain after surgery. It is also used to treat patients with chronic pain who are physically tolerant to other opioids. In an interview with KMUW on May 24, 2022, Sheriff Jeff Easter said, "We'll never arrest ourselves out of drug use." Quote, "We've been trying to do that since the 80s and it is obviously not working," quote. We cannot arrest our way out of this problem. This is a telling revelation because law enforcement, an already overburdened bureau, should not be the sole agency to respond to drug misuse or substance use disorders. Shifting from a criminal justice approach to a public health approach is what's going to save lives. Fentanyl test strips are low-cost solutions to the issue. They are a way for those who use unregulated drugs to check and make sure they are not ingesting or using fentanyl. It is a test that takes 2 minutes and is nearly 100% accurate in detecting fentanyl. Of particular note is how little it costs, at roughly $1 each. It's an inexpensive way to save lives. This is what we call harm reduction. Incorporating a spectrum of strategies that meet people where they are on their own terms. This can serve as a pathway to additional prevention, treatment, and recovery services. However, our biggest obstacle is getting these strips into the hands of people. The truth is, fentanyl test strips work. They combat drug-related deaths, and they connect people to life-saving care that they need. We have to be willing to think outside the box and consider non-traditional interventions to save lives. Lastly, it's essential to include preventionists, harm reductionists, and community-based organizations to join the Kansas Overdose Fatality Review Board. I cannot overstate the importance of ensuring funding be allocated to the prevention sector. It's community coalitions like Safe Streets who are being called on by the community, by the city of Wichita, by KDHE and law enforcement to continue servicing the community in the way we've been doing. So those who have been a part of our outreach efforts, we want to say thank you so much because we are seeing the drive in Wichita. And for those of you who are in the Wichita area, please visit us this Saturday. We're giving away free naloxone February 18th at Lincoln Park on 1323 South Topeka, Wichita, Kansas. Thank you. I appreciate your time.
All right. Thank you very much for being with us here today. Is there anyone else that believed that they had turned in testimony and was scheduled to testify? All right. Seeing none, thank you. Committee, that's all we have on the proponents. I will note that we've got, I'm just not going to read them. We've got 13 sets of written only testimony. So we will now open it up to questions to our conferees. Questions from the committee members. Actually, I have one, and this would be for Dr. Duvey. I can remember it now because I can do the groovy thing. Wish I had a name that rhymed like something like that. Are the fentanyl strips and yeah, that one.
Yeah.
Are they all the same strips, or does each one of those require a different type of strip?
Yeah, they're different strips.
Different strips. So how many strips are we talking about to do what's in this bill?
Well, the fentanyl strips are standalone. I'm not really 100% sure about the date rape strips, the GHB and the ketamine strips. Does anyone know? They're separate? Yeah, so there were three separate.
Mr. Kessler.
I think he's using that term loosely, but that's all right.
So this might not be exactly correct, but it looks like 12 states have developed these oversight boards for this issue. Some have probably been around for several years. Do we know if they've led to any reduction, or if they've kind of what their track history is? And I guess how do we, if we do implement this, recognize we're actually making progress and not just having another oversight board that problem stays the same but doesn't really improve?
And I think, Representative, you somewhat answered your own question. I think several of these review boards are pretty new, and so the research is also relatively in early stages. But I think given our use of other oversight boards, Child Death Review Board being one of them, they do help us make better policy and at least more informed policy. So this is something that we spoke to a little bit in our testimony, but I think that the Fatality Review Board is a good idea.
Thank you.
Representing Gardner and then Representing Berquist.
Thank you, Madam Chair. My question would be, as we look at things like this, this becomes a very emotional issue very quickly, but we need to, we heard testimony earlier here in this committee that with fentanyl, we're dealing with such a small volume product that is mixed then in other drugs, but usually in a very poor manner. And so I wondered, is there any information about how sensitive these strips are, and what is the possibility of false negatives if you don't happen to test the right place in the pill, or where the fentanyl is located, or whether if it's not mixed well in the batch? Not wanting to be negative about this, but I think also we should, that might need to be part of the education process, that this isn't a black and white, maybe it is black and white test, but maybe it's also not completely specific in every case. Could anybody address that topic at all? Yes, please.
Hi, again, Dr. Strickland, family medicine and addiction medicine specialist. So that's a very reasonable concern. No test is perfect, but these tests are immunoassays, which are extremely sensitive. They detect very small trace amounts, even in just the residue of the drug they were using. So a lot of times we're not even taking a piece of the drug, although you can do that. You can use the residue from the package, add water to it, dip the strip, and it's extremely sensitive. So it will false negatives, so that meaning testing and it saying that there wasn't fentanyl in it when there actually was, are extremely, extremely rare. 99% effective on that front, maybe higher than that. False positives are a little different. Sometimes it can detect, especially in like methamphetamine products and some other things, tests say that it's positive even when it wasn't, but that's a little bit more common, still not super common. But you do not need very much of the substance. There is some education that needs to take place around how to do that, like how to add the water and at what amounts, but that education is part of the process of the strips. We're not, a lot of times, almost never is the strip just picked up. We're educating folks on how to use them correctly, and they want to know how to use them correctly.
Thank you very much. Thank you, Madam Chair.
Thank you.
Representing Berquist.
Yes, probably a question for you too, again, sir, or Mr. Kessler. With the concept of the review panels that are to try to remediate this problem in our society, is there a place within those panels, those review panels for law enforcement or drug enforcement that can be a help in I mean, the question I guess I have is this, that in many cases, it's criminal intent, not just overdose of something that you were going to take in a certain measure, but you took too much, intentionally or not. So is there a place for law enforcement to be a part of that review panel to try to help to stop the flow and to help educate those within the panel to guide people and direct them away from those channels of illicit drugs outside the country or inside? Long question. Thank you.
I can't speak to the writer of the bill. I'll have to hand that to somebody else here as far as the intent of including or not including that. I do know that on almost every collaborative panel I've sat on that I've worked to come up with community-based solutions, law enforcement is always included because they're the ones coming to us for help with the solutions. So it would not surprise me if that was requested or amended, but I can't speak to the nature of the bill on that.
Thank you, sir. And thank you, Madam Chair.
Representative Orpesa.
My question is for you, sir. Thank you, Madam Chair. So I know you were talking earlier to the other representative about the test strips. Are they pretty comparative to the Narcan, nasal Narcan? Are they as easy to use, as easy to teach? Is there a great learning curve?
I think it's a little bit more complicated because we're talking about adding stuff. The Narcan, give me 1 second, is very simple. If anybody's ever used Flonase, it's about like that. Very simple, literally squirt. Hard to be easier than that. In this case, we give them usually little handouts or cards that come with the strips that show them if this is their drug that they're using, and they're using, like a little cooker, like 5 mLs, add this much water, put the strip in. It's still very simple, but does require some education, just as this does as well, but probably not quite as simple.
Thank you. Thank you, Madam Chair.
Representative Epley.
Thank you, Madam Chair. And this kind of alludes back to what we talked about earlier in the bill. It does cover GHB as not being drug paraphernalia and having strips for that. And I should know this, so I embarrass myself as a physician. Is that Rofinol? Is that, because I'm used to the street name, or Rofies, or?
I honestly I say GHB also, but I believe they're referring, if they're not the same exact compound, a very similar compound.
But would those strips test for that, for the date rape drug?
I could find that out for you very quickly.
That would be.
I think it's the same compound, but I'd like to be certain of that before answering.
Well, I'm glad I'm not the only one that doesn't remember. I should know that, but I just can't. So if you could find that out.
Does anybody here know? Okay, I'll find that out for you.
Okay, thank you.
Are they different compounds?
The purpose of my question.
Go ahead, come on up.
The purpose of my question is to find out if we're going to be able to test for it, because that is commonly used as the one heartfelt testimony that left gave about I think it was Rofinol probably in those drinks, but I just wonder, are we going to be able to test for that or not? That's all.
And there are different products. The individual strips you might buy from a different manufacturer can sometimes have different sensitivities, specificities, and products. So I'll make sure for that.
Yeah, go ahead and come up and tell us who you are, because you look
I'm Dr.
like
Nicole Yadlinski. I'm also a family physician, and I'm the family doctor of the day. But I was going to say that I believe that ketamine, GHB, and Rohypnol are 3 separate substances. I'm not aware if there are test strips available for Rohypnol. So, but good question, Dr. Epley. I wasn't sure of that either.
All right. Committee, are there further questions of any of our conferees? All right, seeing none, I want to thank everyone being here with us today, and that will close the hearing on House Bill 2390. Without objection, I'd like to go ahead and work House Bill 2390. Did you have, I thought maybe you was coming up to talk to us, Andy. Oh, yeah, Lee and Leah back here holding the bag. Okay. All right, is there objection to go ahead and work this? All right, seeing none, Representative Epley.
Thank you so much, Madam Chair, for the spontaneous opportunity. I would like to move that the committee pass out House Bill 2390 for passage favorably.
Second by Representative Myers. Questions, discussion, any amendments? I don't know. He just Give me just a moment. She knows to wave. I don't see her. Give me just one moment, okay? Are you ready, or you want me to start with her? Okay. Oh, okay. You're fast. Okay. All right. Well, then we'll go ahead and I'm going to have a couple of amendments that, as we've been talking, I've had Reviser Abbott working on. Representative Orpeza.
Okay, so tell me if I'm going to do this right. I have a conceptual amendment to add a nursing component to the board, whether it be the Kansas State Board of Nursing as well, to have some type of a nursing input. Not the hospital's nursing, just nursing.
What line? Youngberg?
He's looking at page 3. If you start on line 17, where it adds 5 additional members.
It doesn't specify nursing. That 5 members to me is very open. Still very open.
Okay, what if we did this, Scott, is that we would change 5 to 4 and then add F. Huh?
Permission to speak.
Yes.
I think when we take away those 5, we're taking away a chance for people who don't fit into the other sectors to not be represented. People who are in prevention, people who are in harm reduction. So if we could keep it at 5, so that the community could have a chance to also be on the board, that's essential.
All right, thank you. I do need a second. Yes, go ahead.
So I just attended the National Overdose Fatality Review Board Forum in Washington, D.C., held by the Bureau of Justice Assistance, and because of the work we're doing here in Reno County. And the beautiful thing about these boards is anybody, as the board is being formed, can be asked to attend. It's great because it's, as you get your format, it can be adjusted as needed. While this one, of course, starts it out and gives you the foundation, as you figure it out and as you determine what you need, that's part of the recommendations that you make as you learn from your reviewing these overdoses and everything. You determine who exactly needs to be at the table to make these recommendations even better as you go through the process.
All right, thank you. All right, now we'll go back. We need a second, seconded by Representative Hasswood on the Orpeza conceptual. So give me a minute here, Scott. I think we're going to here in just a minute. Right, and then just leave. Okay, so Representative Orpeza, I think what I'm hearing you say, and then Reviser Abbott will change it all for both of us, is to add, and we won't reduce the 5, we'll keep the 5 where they're at. So then we would add a nurse practitioner to the list.
So when I was looking at the bill, I saw there was the Board of Pharmacy and the Board of Medicine. And I'm open to whatever Reviser Abbott would suggest, but should it be the Kansas State Board of Nursing or just a nurse practitioner position? Versus yes. This is about dealing with the community, which we would at the same.
The reviser does better than I do. Reviser Abbott.
I won't take credit for that. So I think what I'm hearing is that on the list of agency-appointed members that begins on page 2, line 37, the list I gave of AG, KBI, KDADS, all of them, you could add one to that list that is appointed by the Board of Nursing.
And that would be appropriate.
Yes, I would like to have somebody from nursing.
That's
Thank
what
you.
she said.
Perfect. Thank you.
Well, it would be on page 3, correct, Scott? We're talking about page 3, so you would add a J.
Yeah, you have J,
So J would be nurse, Board of Nursing.
Board of Nursing. Got it.
Everyone understand what we're doing here?
Is the second person okay with that?
Representative Haswood, you're okay with that change? All right. All right, questions, discussions, comments on the PASA amendment? All right, seeing none, would you like to close?
Yes, Madam Chair, I will close. Thank you.
All right. You've heard the motion by Representative Orpeza, seconded by Representative Haswood. All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. We're back on the bill. Is there any other questions or comments, or you want to see the couple of amendments that may have just shown up here first? Okay, we got one of them.
I got 2, one more.
Oh, okay. So we got 3 amendments coming for me. Okay, let's do the one on page 3 first. And this was, as I was reading through the bill prior to the hearing, is this amendment here would strike material in line 16 on the word and then we would add on line 17 behind 9, one member appointed by the Secretary of Health and Environment from a list of up to 3 nominees submitted by the Kansas Hospital Association. So it's adding a member from the Hospital Association. Is there a second?
Clifford seconds.
Seconded by Representative Clifford. Comments, discussion on the amendment? Representative Turner.
So, having not read this in depth, is this the structure of other appointees that they, because if I read this, so one member will be appointed by the Secretary of Health, so they're the ones that chooses from the 3 that are nominated, right?
Mm-hmm.
Is that a parallel to other, or does, like these that the boards are getting, they're not nominating 3 from which the Secretary picks 1, correct?
They're all state agencies.
Oh, okay, that's the difference. All right, I get it. Thank you.
Further questions or comments? All right, seeing none, you've heard the motion by Representative Landwehr, can't even say my own name, seconded by Representative Clifford. All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. The second amendment will actually be on page 4. And this one here, as you get the amendment, is an addition to line 11 to the report is to add House of Representatives Standing Committee on Health and Human Services and Senate Standing Committee on Public Health and Welfare or any successor committees thereto. That way we make sure it goes to a specific committee to actually get reviewed rather just in a shuffle of, oh, here's a bunch of reports to be reviewed by the legislature, which probably will not be seen necessarily by as many people as it should. Is there a second? Second by Representative Bryce. Comment. Get flagged down there. That's what I'm going to do.
Thank you, Madam Chair.
Someone go get me a shocker pom-pom out there.
So my question is I'm freshman. So how often do these reports come out? Is it every 6 months, every year? It doesn't state. Does it need to state? Or that's just something that happens during the
I don't know if our
session?
other one states. Scott will look at that, but normally it's once a year. It's an
Once a year,
annual.
okay.
And I'm getting nods back there from the agency.
Oh, okay, perfect.
But do we need to state that in here? That's all right. Scott's looking. Yes, Scott. Supervisor Abbott.
Thank you, Madam Chair. So much of the language and the structure for this board is based on the current KDHE Maternal Death Review Committee. I'm not sure if that's the exact name, but the statute establishes a committee for that topic. That statute does not prescribe a frequency of reporting. It also has a general requirement to disseminate findings to the legislature and others.
Representative Orpeza.
Okay, so I like working with deadlines. Is that possible to add at least a yearly update?
We could.
To ensure that we are addressing what needs to be addressed in a timely manner. Or at least be updated.
Where do we add that at? Yeah. Annual. Yeah. Does January sound good back there? To report to the legislature by January?
Like first day of
Or,
session?
yeah, first day of session.
Yeah, Madam Chair, so it's on the same page, and in that same paragraph 8, I would just insert language, disseminate findings and recommendations on or before the first day of each regular legislative session to the governor and the remaining list of people.
And that's fine by the maker of the amendment. Is it fine by the second? Is everyone clear what we're doing now? Discussion, comments? All right, seeing none. All those in favor of the motion made by Representative Landwehr, seconded by Representative Bryce, signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. Now we're back on the bill. Do we have any more yet? Okay, we've got one more amendment coming. Does anyone else have any recommendations, suggestions, or questions? Representative Vaughn.
Thank you, Madam Chair. I just wanted to recommend, if we find out that the chemical composition of the GHB is different from Rohypnol, that we might include the Rohypnol test strips in this bill as well. And I don't know if there'd be.
Representative Epley.
Thank you, Madam Chair. I don't know if anybody in the room knows the cost or the availability of Rohypnol. It sounds like a great concept, and we should do it. I just don't know how practical it is, and I'm looking to someone in the audience to stick their hand up and say they know. But
No, if you'll go ahead, step up to the mic, please. It's Duvey.
I thought it was a great question. It appears they are.
need to announce your name, please.
Oh, sorry. This is Dr. Joan Duvey from KDHE. And they are separate, but it appears that the test strips are already being sold at the CVS Pharmacy on Iowa Street in Lawrence. Yeah. So. I was going to say, I think they're already legal. Yeah, I think they must already be legal. And if they're not, then maybe we should add them.
Okay.
Perfect. Thank you.
All right. Questions, comments beyond that?
Well,
does that answer your?
We need an amendment.
No, we're waiting on an amendment. It's printing right now. Hey, I gave those to him while we were sitting on the House floor. He did good to get us this far.
Don't we need an amendment for Vaughn's amendment? For the Vaughn?
She's not doing, no, she's not doing it. She's got her answer. Because we don't need an amendment. You just got all excited on amendments, I know. Thank you, Revisor Jenna. All right, committee, one more amendment here, and this will be on page 7. This will be an addition to line 10. Any person who knowingly discloses any information or record made or kept confidential pursuant to the Kansas Overdose Fatality Review Board Act shall be guilty of a Class A non-person misdemeanor. Is there a second? Second by Representative Boyd. I don't have any friends. Thank you, Boyd. I appreciate it.
Oh, second.
Now I won't hit you in the back of the head as I walk into K-12. Committee discussion, comments, or questions on the amendment. Representative Bryce?
Just a quick question. Thank you, Madam Chair. What kind of penalty would go along with something like the non-person misdemeanor? Any
About
ideas?
a $2,500 fine. Is that correct?
Yeah, thank you, Madam. Class A misdemeanor, non-person misdemeanor, as up to 1 year confinement in the county jail, but frequently, instead of that, it is up to a fine of up to $2,500 and probation.
Thank you, Madam Chair.
Further questions, comments, discussion on the Landwehr Amendment? All right, you've all heard the motion. Okay, I thought you was waving already. All right, you've all heard the, I'm sorry, Representative Vaughn.
Thank you, Madam Chair. I was wondering, I know that the confidentiality of information was something that was discussed in regards to the Child Death Review Board as well. Is it similar to what is reflected in that law? I was just curious if it's handled in the same way.
Supervisor Abbott.
Thank you, Madam Chair. The statute that creates and governs the State Child Death Review Board does not prescribe a criminal penalty for disclosure of information that is confidential before that board. I would add that the Class A non-person misdemeanor is consistent with current law that handles certain confidential law enforcement investigative information, the unauthorized disclosure of that. It is similar but not quite the same as the unauthorized disclosure of information from K-Trax. That's a severity level 10 non-person felony, which can vary depending on criminal history, but is fairly equivalent. And this is also the proposed penalty for the KBI FBI fix to state fingerprinting and criminal history record check information. That is the penalty that is being put in place for the unauthorized disclosure of that fingerprinting criminal history record information.
Representative Vaughn.
Thank you. That's helpful context.
All right, you're welcome. Committee, further questions or comments on the Landwehr Amendment? All right, seeing none, you've heard the motion by Representative Landwehr, seconded by Representative Boyd. All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion passes. Is there anyone else with questions, comments, or amendments? All right, seeing none, Representative Epley.
Thank you, Madam Chair. I would move that the committee pass out House Bill 2390 favorably for passage as amended.
Seconded by Representative Myers. Questions, comments on the motion? Representative Clifford?
Yes, thank you, Madam Chair. A chance to comment. I just appreciate all of our folks who were here in testimony today. It's obvious that this is greatly needed. I appreciate my colleagues not dirtying it up for the Senate to reject it. I pray for quick passage. Thank you very much.
I can't guarantee passage from the Senate. We tried something last year and it didn't necessarily work well, so. But thank you for your words.
Good intentions.
Any other comments or discussion? All right, seeing none, we're now on the motion to advance House Bill 2390 as amended. Favorable. All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. All right, committee, we do have a few other bills to that we're working on, but let me see.
Back to 2340.
All right, we're going to go back to the BSRB bill that we started yesterday, which is House Bill 2340.
Madam Chair, I do have an amendment for that when it's in order.
All right. Representative Clifford.
Madam Chair, I would move an amendment. I think we'll pass
Oh, wait a minute,
out.
just a moment. Let me, Scott, being we opened that yesterday, are we still opened or I have to reopen it? Okay, we're gonna reopen working House Bill 2340. Do I need a motion and a second? Yes or no? Okay, Representative Epley.
Madam Chair, I would like to reopen House Bill 2340 for working at this time.
Seconded by Representative Clifford.
Second.
All right. Discussion, comment, Representative Clifford.
Thank you, Madam Chair. I'd like to move an amendment. You should have it distributed to you shortly. This regards the application process and an expedited application process. Does everyone have their copy? Yes, Representative Epley, this regards the application process and an opportunity for an expedited application process.
Is there a second? Second by Representative Epley. Discussion, comment? Would you like to explain any further, or are you good?
I think I'm good, Madam Chair.
Okay.
It's very self-explanatory. Thank you.
I believe that there's been some discussion since yesterday with some folks of it might be easier and simpler path for everyone if we went from, instead of 10, it would be 15 days. Would you object to changing that?
Modification, a new section 2 within 10 business days, and yes, that's where it would appear on page 2. New section 2 within 15 business days. And then modify B1, the last sentence also indicates a 10 business day. Are we asking to modify the expedited application or just the notification? So
where's that at?
2A is a 10-day to notify the application after receipt, the applicant. Under B1, we're talking about expedited applications issued within 10 business days.
They both probably should be 15.
Okay.
Yeah.
So
Okay.
modified. Yes.
All right.
So it's a friendly, and yes, I accept it. Great. Love it, love it.
And Epley accepts the change. So does everyone understand what we're doing? Questions or comments on the amendment? All right, seeing none. Representative Clifford, you may close.
Madam Chair, I close and move my amendment as amended.
All right, you've heard the motion by Representative Clifford to amend, seconded by Representative Epley. Comment, discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Motion carries. Back on the bill. Let me get my act together here. Done. Representative Epley.
Yeah, thank you, Madam Chair. I do have an amendment here for House Bill 2340, and it relates to getting rid of the behavioral analyst position on the board, and that is outlined on page 60. Correction, where is that? Yeah, and it's there, and it's, yeah. It is, I just had to clarify, and I apologize, Madam Chair. It is
Well,
online.
this here, I'm sorry, the copy you're reading from is not color, so it doesn't have a red stripe through it, so
Well,
revise your app. It's
Being
gonna make
colorblind,
sure.
I'm not sure that's beneficial, but.
Oh, it says language over here, stricken.
Yeah, okay, well,
So it wouldn't have been red stripes anyway, would it?
and being dyslexic also. But anyway, on line 17, we're striking the behavior analyst on line 17 on page 60, if for those of you that are reading along here and at home.
And thereby reducing the number to 12.
And thereby reducing the number to 12. Thank you. Yes, thank you.
Motion made by Representative Epley. Is there a second?
I second.
Second by Representative Turner. Discussion or comment, and I understand Representative Bueller, you had a question. Was it on the previous one, or
He has an amendment.
or you have an amendment? Okay, yeah, give us a moment.
Patient. Thank you for being patient.
We'll get there. We've got a few amendments, like we said yesterday. So, question or comments, discussion on the Epley amendment?
That's mine. Is that yours?
Yes.
Okay.
Give me my note back.
Okay. Do I have a copy?
Discuss.
I don't have a copy. Please. I got to keep track of this shit. I got to write this.
Discussion or comment on the Epley amendment? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. Back on the bill. Representative Orpeza.
Madam Chair, I also have an amendment to remove the language for the supervisory, board-approved clinical supervisor.
You've heard the motion by Representative Orpeza. Is there a second? Second by Representative Myers. Is it Meyer or Meyer? Meyer. Meyer. It's okay. I'm sorry.
An application for a board-approved clinical supervisor.
Discussion, comment on the Representative Orpeza amendment. All right. Seeing none, you may close.
I'll close my amendment, Madam Chair. Thank you.
All right. You've heard the motion by Representative Orpeza, seconded by Representative Myers. All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. Representative Bueller.
Thank you, Madam Chair. I have an amendment on behalf of Representative Barth, and it's, I guess, wait till we pass it out. Lines 10 and 11, it's basically where we talk about extending the license period for temporary licenses. That says 12 to 24 months in the bill. Representative Barth has requested we just strike that and leave it at 12 months. So, and the logic was no reason to go to the 24 months. The applicant should have enough time within that 12 months to successfully pass the board examination. And the lines that you would strike then are on lines 10 and 11, and where the changes are made throughout the bill. And it really just changes the 12 to 24. It strikes the 24 and leaves in the 12 months. So you'll find that on lines 14 on page 7. You'll find similar on page 17, line 28, and throughout the bill as the revisor has passed out the changes. There's another one on page 27 and 36.
Okay. Motion made by Representative Bueller, seconded by Representative Epley. Discussion or comment? Representative Clifford.
Yes, Madam Chair, I would object to this amendment. Having been being someone who stood for exams like this while working, which these individuals likely do, you often need extra time to study. So 2 years goes by in a flash, and at my age, I don't think we need to make it any shorter. Thank you.
Further comment, discussion? Representative Boyd.
Thank you, Madam Chair. I also would object. I think we heard testimony yesterday that this was also put into to help with the workforce issue, allowing that additional 12 months for folks to stay in the profession and also complete that licensing time.
Representative Berquist.
Thank you.
Excuse me. I'm going to move you guys next year. I actually have to turn around. I'm separating.
If it's amenable as amendment, I might go ahead and adopt him.
Representative Burkamp, I apologize.
Thank you, Madam Chair. I just second what Dr. Clifford said. I would be in fan of 24, not 12 months. Thank you.
Okay. Well, and I think that Representative Boyd is correct in his comments. And if I can get a nod, yay or nay, from David Fye, that was why it was going from 12 to 24 was for what Representative Clifford was talking about. And as Representative Boyd, that's what our testimony was that we heard yesterday. It gives them a better opportunity to get through it. And this is to help. This is because they're working now. And then we can have them out there in the workforce.
And I'm just, again, just helping represent Representative Barr's position on this. Her position, and she and I discussed this, is there wasn't any actual data that said the 12 to 24 months is going to increase anything. So that was the premise of the motion. So that was the rationale for it.
All right. Further discussion or comments? Yeah, I would not be supportive of it just because of what the BSRB brought to us. And anything that helps us get our workforce out there, we're willing to try. It does not mean that we can't come back later and change it at a future date. But I appreciate where Representative Barth is coming from. And this is good to have these types of discussions, whether we like it or not, because I can tell you what, I've gone down in flames a lot of times with motions, whether it's on the floor or it's in committees, and it happens.
Thank you, Madam Chair. So from a procedural standpoint, the proper way for this to go down in flames is what?
Well,
that's what I'm looking for.
One, you could let us all vote on it, or you could withdraw it, and then you haven't gone down in flames.
Well, I knew there was the option to withdraw it, so I'm just trying to think what's the most grandiose way to do this. Do we go down in flames big, or do I just withdraw the motion on her behalf?
Well, I would withdraw it, but that's a personal decision, because I've gone down in flames because I felt strongly enough on something that I was willing to do that. So it's up to you.
So, Madam Chair,
it's not a big deal either way.
If Representative Barth were here, I'm sure she would want to withdraw this motion. So I respectfully withdraw this motion.
Okay, we've withdrawn the motion. Is the okay with the second?
Oh, absolutely.
Okay.
Madam Chair.
Just one moment here.
Oh, yeah, sure. No amendments. Yeah.
Representative Berquist.
Yes, ma'am. On the House floor, occasionally, anonymously, we have someone that helps it go down in flames by going. Yeah, better whistler than I am.
All right, Representative Epley.
Thank you so much, Madam Chair. In an era of total cooperation, on House
Representative Epley.
Yes, thank you, Madam Chair. I would like to propose an amendment on House Bill 2340. We're on number, well, this is 7, but 1 has failed, so I guess this is replacement 6. This would establish a community-based license for community mental health clinics, and that basically is on several pages of this. There's on page 1 and page 7, big balloon that goes into this, and gosh, page 11, page 17, another big balloon, page 21, page 26, page 31, holy man, page 47, and that's all.
You've heard the motion by Representative Epley. Is there a second for the motion? Representative Meyer. On the Epley amendment, would you like to explain any further? No?
No, not really.
All right, discussion or comments on the Epley amendment? Representative Blacks.
I would like to hear Representative Epley's golden voice as to why we are doing this. Just, a little short thing. It looks like we're bringing all of them under one license. Am I correct in thinking that? Because we got multiple community-based license for all of them, or is it going to be just one license, or is it still going to be individually?
On the CMHCs?
Right.
No, they'll still be individually.
Okay. All right. Thank you for that clarification.
I had to stop and think. I've had a few motions go past me here. Questions, further comments? Representative Vaughn.
Thank you, Madam Chair. As someone who's newer to this topic, I was just curious what a community-based counselor does and if there are similar positions to this in surrounding states, or just a little more background. Thank you.
Kyle, would you like to explain that? Tell us who you are.
Sorry, thank you. Question again, Representative?
Yeah, if I may, Madam Chair. Thank you, Kyle. I was just wondering or hoping for a little bit more information on what the community-based license, or for the community-based professional counselors, what their role is.
Sure.
The addition of that.
So the idea behind this, and we're in mental health, so rarely do we use 10 words where 1,000 will do. And I think that when we looked at this opportunity, the idea was that for people who had not passed the exam but were working at a licensed community mental health center, having that supervision and continuing to work, and also be able to bill Medicaid and other payer sources, that's the goal behind this, is to give that 2-year window. And then also the community mental health centers will have the vested interest in making sure that these people can then pass the exams.
That sounds like another opportunity to increase workforce opportunities in this
Absolutely.
field.
That's right.
Great. Thank you.
Further comments or discussion? Representative Epley, you may close.
I close.
You've heard the motion by Representative Epley, seconded by Representative Meyer. All right. All those in discussions, well, I'd forgotten already. All those in favor signify by saying aye.
Aye.
Opposed, no. The ayes appear to have it. The ayes do have it. Motion carries. Back on the bill.
Thank you so much for the opportunity, Madam Chair.
Are there any other amendments? I'm not going to let him talk until we check with everybody first. All right, Representative Epley.
So you get me ready to go, and then you shut me down. Okay. Okay. Thank you, Madam Chair, for this opportunity again. I would like to then ask that the committee pass out House Bill number 2340 favorably for passage as significantly amended.
You've heard the motion by Representative Epley, seconded by Representative Meyer. Discussion, comments on the bill as amended. All right, seeing none, all those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. And we're double checking something here real quick. I'm doubting me, Dave, not you, me. Because now I'm kind of ticked at myself.
Heather, better give me your email and I'll email you the bill brief because you're not going to do the bill brief on this.
I wasn't told I had to.
Well, you need to get on her ass because
It's going to be tomorrow.
An act concerning the behavioral sciences relating to professional counselors. Yes. And I
$25 fee.
Oh, yep, okay. If you remember, was it yesterday we did this or day before? Whatever, someday this week, we heard this bill. And there was discussion on that there wasn't a charge in here for the administrative side. And we have put that in our other compacts. So we have, what this amendment does here is it adds a $25 fee, or not more than $25 in addition to any other applicable fee. All right, just a moment, committee. Let's back up just a moment. I withdraw my motion. Representative Epley.
Thank you, Madam Chair. In the interest of backing up, I'd like to move that this committee pass out House Bill 2288 favorably for passage.
Motion by Representative Epley, seconded by
Dr. Clifford.
Representative Orpeza. All right, now we're on the bill to work it. So the amendment again goes back to not more than $25 for a charge on the compact. And that'll match our other compacts that we have out there. Is there a second? I believe it was Representative Orpeza on the second. Comment, discussion? Does everyone remember that? All right. At this time, I will close. On the Landwehr amendment, seconded by Representative Orpeza. All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. Back on the bill of 2288. Any other amendments or discussion on 2288? Representative Epley.
Thank you, Madam Chair. I move that the committee pass out House Bill 2288 favorably for passage as amended.
All those in favor? Oh, I need a second. Representative Meyer. All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. 2259. have either. Representative Epley.
Thank you.
Make your motion to advance.
Thank you, Madam Chair. I would move that we advance and pass out House Bill 2259 favorably for passage.
Clifford seconds.
Motion by Representative Epley, second by Representative Clifford. Discussion, comments, amendments. Representative Orpeza.
Madam Chair, I do have an amendment for 2259.
Okay. Okay, we don't have the copies down here, but that's all right. Revisor Abbott can explain it. You're fine. No, you're fine. This time of the year, when we're moving this fast, that happens. Okay. You're good. Revisor Abbott. And then you'll just get me a copy for my file.
Talking about the cheerleader. Yeah, I am. She packs them in. Try being her boy. Try being her little minion here.
You do a good job.
Oh, yeah.
Thank you, Madam Chair. I believe the substance of the amendment is that there are 7 references to a physician who has prescribed a drug or drug therapy. And the amendment would be to change those 7 references in current law in the bill to the term prescriber. And the term prescriber is defined in the Pharmacy Act to include a practitioner or mid-level practitioner. And practitioner is a physician, dentist, podiatrist, vet, optometrist, scientific investigator, and mid-level practitioner includes certified nurse midwives engaged in the independent practice of of midwifery, an APRN who has a license with independent practice to prescribe under last year's bill, a physician assistant who is licensed and has authority to prescribe pursuant to a written agreement with a supervising physician, as is currently required by the physician assistant practice statutes. So it would include all of those people who are referenced in the Pharmacy Act who have lawful authority to prescribe drugs.
All right. Is there a second on the Orpeza? Seconded by Representative Boyd. Comments or discussion on the amendment? Does everyone understand? All right. Representative Orpeza, you may close.
Thank you, Madam Chair. I close my amendment.
All right. You've heard the motion by Representative Orpeza, seconded by Representative Boyd. All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. Back on the bill. Comments, discussions on the bill as amended. Representative Epley.
Thank you, Madam Chair. I would move that the committee pass out House Bill 2259 favorably as amended.
You've heard the motion by Representative Epley, seconded by Representative Orpeza. All those in favor signify by saying aye.
Aye.
Or as amended, did I say that?
I said it.
Oh, yeah, I didn't say it. All those in favor signify by saying aye. Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. One more bill, committee, and we don't meet at 5 o'clock. House Bill 2049. And Dave, none of these are...
This is on the same.
All right. Committee, actually, it's an error on my part. We are not working that bill. I know some of you got excited, but that's kind of the way I am. Anything else that I have forgotten, gentlemen? All right. I want to thank everybody for their attention and the help that you've given on this. We will be meeting on Monday. We will not meet tomorrow. We will not meet Friday. We will have two bills on Monday that are rather short bills, and we will plan on hearing them, working them, and advancing forward if the committee chooses to do so. And then we will not meet on Tuesday. So we are done until Monday at 1:30.